in the
Real Country 1430 AM and 107.3 FM WRDN. I'm Brian Winnekins, and joining us this afternoon is Pepin County Health Officer Heidi Stewart as we get an update on COVID-19. Heidi, thank you for joining us today. Well, earlier this week, the health department had an alert for folks that may have went to some area businesses on August 6th, 7th, and 8th. Tell us about that.
Yeah, so there's a few reasons behind why that and why now. So early on during COVID, we did the community public alerts when we had a case and we were not able to identify all the potential close contacts. For example, if I worked at a business and I was feeling fine on the weekend and then I got sick on Monday and I don't know who I all worked with, that's a reason to do that. And we had that situation now over this past weekend where an individual visited a couple establishments over the weekend and really wasn't able to identify all the potential close contacts. Why now? We all know COVID's out there. You know, why do you have to do that? You know, we're assuming that risk. You know, some could say we're assuming a risk of being exposed to COVID when we go out and about and do things. Why do you have to tell us about that now? Well, I think it's really important for us to re-up the ante a little bit on our notifications to the community for a few reasons. We had a pretty slow stretch for a while. I mean, we had quite a few days where we didn't have any cases. Now, in the last 26 days, we've had 35 cases. 6 of those cases have been in fully vaccinated individuals. So that is concerning. And that is one of the reasons why this notice was important, because we could have people who are fully vaccinated or not fully vaccinated that assume that at those establishments over the weekend, you know, there was no risk of COVID, and that's not true. There is a risk of COVID. We had a positive individual attend those events, unknowingly attend those events.
And so you mentioned that we've seen a jump in cases here in the county.
Yes. Yep. So I do have something to share for that. So I know there are people offline that can't see this and are maybe just listening. What I'm showing is total new cases by date and then the active cases. So we are experiencing kind of a mini wave. So in Pepin County, we didn't have much for cases until July of 2020. Then we had a small wave and then a significant next wave of pandemic as far as cases are concerned between October of 2020 to late January of 2021. We have had a few other blips on the map, but I would say that this one now, the 36 cases or 35 cases in the last 26 days has been another substantial increase. What we're seeing with those cases are more symptomatic individuals. They were tied early on in this little wave, if that's what we want to call it. They were associated with some younger children. They, you know, maybe weren't so symptomatic, maybe had some mild symptoms of a runny nose and congestion. We're seeing more individuals now. The average age of all of these cases is 38. 5 of them were under the age of 1. And we're seeing more people with symptoms, and the symptoms seem to be more significant, where the fever is a little bit higher, the cough is a little bit worse, the shortness of breath is a little bit more concerning. The good news is we have not had any hospitalizations during this 26-day period, and we have had no COVID-related deaths during this 26-day period. So that is the good news. We still believe that the vaccine does provide protection against that severe illness and hospitalization, but as far as 100% preventing it, we're not seeing that right now. That 6 vaccinated individuals is 17% of the total cases that have tested positive.
And so what's the Department of Health telling you, or what are you, when you talk with your colleagues, what are you expecting over the next few weeks as school gets ready to start?
There's been a lot of discussions and there's a lot of what I would say concern, because the mitigation strategies that we've talked about since the beginning of the pandemic are really the same. The physical distancing, the cohorting, keeping your circles small. We were able to, say that we were pretty good at those mitigation strategies early on with the state, the mask mandate that was an order by the state. We don't have that tool anymore. I don't see a state mask mandate coming down. I don't see a local public health mandate or order coming from Pepin County. So really they're the recommendations and they're the ask for people to protect themselves and their community. So make sure if you're sick, you're staying home and following up with your provider to see if a COVID test is appropriate for you. If you've been exposed, please take the quarantine serious and wait the 5 days or 5 to 7 days until you go in to be tested, and follow through with that quarantine. If you've been diagnosed, absolutely do your isolation. I mean, that is not something that should be optional. That's not something that people should say, well, I feel better now. I think I can go back to work. That's not okay. You could be exposing other people with underlying conditions, and it could be a significant situation for those individuals. So the concern is that we don't have all of those things that we did really, really good last year in the Pepin County area. We don't have all those pieces of that safety net in place right now, community wide. So we would encourage people, continue to encourage people to get vaccinated. If you have concerns about that, contact your primary provider, talk to them about it. We are at 45.2% now. I want to send a shout out to the 16 and 17-year-olds. That vaccination rate for 16 and 17-year-olds is now up close to 52%. So I think what we're seeing there is some kids who had situations where they had to quarantine, and if you're vaccinated, you don't have to do that quarantine. So you don't have to miss school and some of those other things that are important to you. That's potentially what we're seeing there. Very positive on the vaccine front. Every single week since July 11th, our vaccination numbers per week have increased. So, we went from giving over 100, sometimes in the several hundreds each week, down to giving as low as I think it was like 26 before July in 1 week. And now we've seen those numbers climb up to where I would say we're averaging giving at least 35 vaccines a week here at the health department. They're available. Call us for an appointment if you are interested or if you have questions. We have all three brands, the Pfizer, the Johnson & Johnson, and the Moderna. We will not be using the Moderna pretty soon going forward. The reason for that is that it comes in a 14 dose vial, and we don't want to be wasteful. So it doesn't really work for a small health department to have that. The Pfizer vaccine, the FDA has formally approved the biologics license application for the 16 plus for Pfizer vaccine, which means that we could be looking at that full approval instead of the emergency use authorization very soon for the Pfizer vaccine for that 16 plus population. So that's good news too.
Talking with Pepin County Health
Really
Officer Heidi Stewart.
your
I mean, you did. And Heidi, I know we're in a high transmission category, the red category from when I've looked on the map. Are all of the other counties around us in the same situation?
Yeah, so Pepin and Buffalo counties were some of the first in our area to go from the lower case numbers and raised pretty quickly to the high. Some of the counties were in substantial transmission for a while. I think we've talked about this before. For Pepin County, because of our low population size, a couple cases really makes a big difference for us in that high category. So we do go to the high category quite quickly. Looking at that map solely is not really the best gauge of the amount of community transmission. But when we see the number of cases we're seeing, I think we've got 5 new cases in today, and they're spread throughout different areas. That is concerning. Early on in this recent phase, we knew where the cases were. It was in this outbreak or this outbreak and this outbreak. Now it's spread all over the place. So there's exposures happening in the Stockholm area, in the Pepin area, in the Albany, Lima, Frankfurt, Waterville, Durant. I mean, they're happening all over. So we can't just say this is a Southern County transmission issue or a northern or a western part. The transmission is happening community wide. So I think that high category where we're in the red right now is accurate.
All right. Well, Heidi, again, we appreciate you joining us today.
Thanks, Brian.
That is Pepin County Health Officer Heidi Stewart. You're listening to WRDN.